that COVID-19 will be around for some time. Ladies and gentlemen, you will recall that the Honorable Health Minister was here a few days ago to discuss. His Excellency the President has also been speaking. Today, the Honorable Information Minister will join us to discuss how Ghana will be getting ready for the new normal. May I respectfully invite the Honorable Minister for Information, Kojo Oppong Nkrumah, and Member of Parliament for the good people of the Ofuasi Ayuribi constituency to discuss getting ready for the new normal.
Honourable Deputy Minister, thank you. Colleagues, good morning. Mine is just a few remarks, actually. I think early next week, our colleagues from the Ghana Health Service will do an updated presentation on the dynamics of the virus as is operating here in Ghana. So early next week, we look forward to a presentation from our colleagues from the Ghana Health Service on what we know so far about the virus as it operates here in Ghana, or the dynamics of the virus. But this morning, I just have a few remarks to make. As the Honourable Deputy Minister mentioned, yes, indeed, last week, the Minister responsible for health used an expression in his presentation. His Excellency the President yesterday also used the same expression when he met traditional leaders, I think from Anglo. And that expression, which is also now becoming an expression for public discourse, which we want to spend just a few minutes on, is living with the virus. Living with the virus. We're not talking about you getting the virus and living with it, no. There's a context within which we are speaking and within which we would like to invite the nation to a conversation. One fact is that COVID-19, as we've been told already, is now a global pandemic, and the virus, what it means, is present in several countries all over the world. The other fact is that today, as we speak, the world does not have a vaccine or a validated cure for it. And even to add to that, we do not know exactly when a vaccine or a cure will be discovered. We continue to keep our fingers crossed that the scientists all over the world, including here in Ghana, who are working, will come to a good answer soon. But the fact is that the COVID-19 virus is around the world, in the ecosystem around the world. There is no vaccine or cure now. We do not even know when exactly there will be a vaccine or a cure. The other fact is that the world is coming to a realization that what appeared to be one of the best preventive methods, which was everybody stay at home, be locked down at home, cannot go on in perpetuity. And so at some point, as you are seeing all over the world, there will need to be an easing of some of the restrictions, even while the virus remains in the global ecosystem. So the expression which has been introduced, which we are inviting the nation to a conversation around, is living as normally as we can while the virus remains in the global ecosystem. And that's what we mean by living with the virus in the global ecosystem. So the question is this: what does it take to live as normally as possible while the virus remains in the global ecosystem and while ensuring that the population is adequately protected? We need to start having a national conversation and consultations of various stakeholders about this. Indeed, some of the consultations have started already. I recall at our briefing, I think last week, we mentioned some of the groups that government had started engaging, some of the proposals that we had started receiving. But this morning, we also want to encourage, in particular, our colleagues in the media, to, as you have done so far, to join us to play your part in this level of public engagement about what it takes to live a new normal while the virus remains in the global ecosystem, while we protect ourselves. The deeper the public engagement, the better the options we will have. As I mentioned earlier, the question before us is not whether or not it is possible to ease some of the restrictions. The question is, what does it take to ease some of the restrictions while ensuring that the population is protected? Several engagements, as I just mentioned, have taken place already and will continue in the coming days. But as part of the social mobilization efforts, we need to start having a proper national conversation about this. And we'll be leading part of that conversation from the state side, but I want to encourage you, our partners in the realm, the fourth estate of the realm, our colleagues in the media, to join us and also to begin to get out of the general public and various stakeholders their thoughts, their submissions on what it would take to live the new normal, i.e. ease as much as can be done while protecting the population, while the world is yet to find an antivirus or a cure to COVID-19. And therefore, if you hear the president talk about living with the virus, or if you hear us using the expression, this is what we mean, and this is what we ask of you to help us to do to have this broader national conversation and get as many perspectives as possible. Also to mention that it is not as though there are some specific timelines ahead of us to do this, but we must start confronting this reality, start having this conversation, even determining what time is a good time to come up with this. Before I take my seat, there are two quick clarifications that I need to make. Earlier this week, there have been two, may I say, misreports that have gone deep in the media, and we need to correct it. One is that government says that it has requested for the Madagascar cure, and there are even other reports that says that we have received it and we are testing. I just want to be clear on that one. What we have said is that Madagascar has reached out to us with their supposed or their suggested cure, and that we will test it through FDA and Center for Plant Medicine before making a decision. The brief as I have it is that we have not received this supposed cure from Madagascar. There are also local offers, local Ghanaians who say they have some sort of preparations that they believe can cure. The Center for Plant Medicine and the FDA stand by to test whatever of these supposed cures are available. And after those tests have been done, a decision can be made by the clinicians. So I just want to be clear, the reports that Ghana has requested for, or that we have received and we are testing a cure from Madagascar, is incorrect. What we have said is that they have reached out to us, as they have done to many other countries, that they have something that they believe can cure. What we will do is that we will test it when it is made available to us. We have said that if indeed they have a cure, no challenge, they should let us have it and we will test it and see. At the same time, there are many other local persons who say they have a cure. The same testing regime, FDA and Center for Plant Medicine will test it and make a determination. So please let's be clear, we have not requested for it, neither have we received any. So just to clear up that reportage. There's also a second reportage I need to clear up, that schools are to reopen soon. We have observed from our Media Monitoring Center lots of reports that say that government says that schools are to reopen soon. With the greatest of respect, it is not correct. Government is not saying that schools are to reopen soon. What we are saying is that consultations on what it takes to reopen schools is what we are currently engaged in. If there's been a misspeak or something of the sort, just to put it in its right context, consultations on what it takes to reopen schools as part of the potential easing of the general restrictions that we are living under are what have started. Now, we notice that there are a lot of stakeholder groups and parents and unions that appear a bit apprehensive since those reports came out. It is okay to be apprehensive. Indeed, if we were not apprehensive, then we will not be sensitive to the challenges of the time. It's okay to be apprehensive. It is okay to have worries. It is okay to wonder how this will be done. But we must channel those apprehensions and those worries towards answering the question, what does it take what should be the indication of a good time? What will be the best way to protect teachers, non-teachers, students, if we are to open up at some point? Government believes that we as a nation can do many things that we put our minds to. And yes, this is a complex global problem, but if we put our shoulders to the wheel, the best of our creative juices and the positive spirits that we have can help us come to the line of best fit on what to do if we decide to ease some of these restrictions. So it's a good time to start having this conversation. We invite the nation to join in this conversation. We particularly want to ask you, our colleagues in the media, to also, as you've done so far, and you've done a fantastic job, play your part by also getting all of these recommendations and ideas come to the fore. What does it take if and when we get to that point that we want to ease the restrictions? While the virus is still in the global ecosystem, while they haven't found an antivirus yet, and while no society can be in lockdown or restrictions in perpetuity, that line of best fit of what does it take to ease as much as we can and still protect as much as we can. And that's a conversation that we're inviting the nation to. I thank you for your time, and we wish you all the best. Honorable Deputy Minister.
Thank you very much. We'll take a moment to sanitize the podium and to also remind colleagues who will use the podium to remember to use the hand sanitizers. So we are grateful to the Honorable Minister for information, for those important remarks. The Minister just invited the nation to begin a conversation on living with COVID-19. The Honorable Minister has also clarified and explained that Madagascar reached out to us. The testing protocols are being followed. Again, even the Center for Plant Medicine and the FDA are also working with traditional and indigenous Ghanaian medication, and as and when work is complete on those ones as well, information will be made available. Schools are not starting soon. Of course, consultations around those have resumed, but it is maybe a question of misrepresentation that schools are starting soon, and one wonders what the definition of soon is. So we are grateful to the Honorable Minister. On Tuesday, May 16, 2020, His Excellency the President launched the Coronavirus Alleviation Program Business Support Scheme. The President earlier in his 5th address announced, and I quote, "Government in collaboration with the National Board for Small-Scale Industries, NBSSI, business and trade associations and selected commercial and rural banks will roll out a soft loan scheme of up to about 600 million Ghana cedis, which will have a 1-year moratorium and 2-year repayment period for micro, small, and medium-scale businesses," end of quote. Madam Kozi Yankee Aye is the Executive Director of the NBSSI, and I shall invite her to give the people of Ghana an update on the Corona Alleviation Program Business Support Scheme that has just been launched by His Excellency the President. Madam Edie.
Good morning, and thanks for having me, Deputy Honorable Minister. Good morning to our media as well. On Tuesday, 19th of May, the President launched the CAP BUS, Coronavirus Alleviation Program Business Support Scheme. It was a very eventful and a joyful moment for all of us. And the two products that were part of the scheme were the ADUM loans and the Nidasoɔ loans. These two products were designed, as we had mentioned earlier, one, to bring hope to the micro, small, and medium enterprises that had been negatively impacted by the coronavirus that is ravaging throughout the country and the rest of the world. So we believe that these two products would bring hope in Nidasoɔ to the good people of Ghana. Currently, and as the President, His Excellency Nana Addo Dankwa Akufo-Addo had mentioned, 600 million was what he had initially committed towards MSMEs as support for them to grow their businesses and sustain their business at a time when there was so much happening around them. But thankfully, through stakeholder engagements and support from the participating financial institutions, the commitments had increased to 1 billion Ghana cedis. 400 million cedis was added on by participating financial institutions as commitment to support the fight and to strengthen the micro, small, and medium enterprises of this nation. After the launch on Wednesday yesterday, the application portals and the application process was opened. The last time I was here, I mentioned to you that we were testing it to ensure that it was efficient and that we would be able to accommodate as many people and to provide accessibility to the people of Ghana, mostly the micro, small, and medium enterprises. And I'm happy to say that we were able to launch the technology to allow for the micro, small, and medium enterprises to apply. The target beneficiaries continue to be the micro, small, and medium enterprises who have been negatively impacted by the COVID-19 pandemic. Also, those who are making goods and services that will support the fight against the COVID-19. When people think of micro, small, and medium enterprises, the definition, as defined by the Ministry of Trade and Industry, is micro is 1 to 5 employees, small is 6 to 29 employees, the medium is 30 to 99 employees. Any enterprise or business that falls outside the range of 99 employees is not qualified to apply for this intervention. The interest rate, after deliberations with the President and the Ministry of Finance and Ministry of Trade and Industry, after conducting a survey with about 1,700 MSMEs in Ghana, initially we had suggested 5%, but the President, in consultation with the team, decided to review that interest rate due to the plight of the Ghanaian MSMEs at a time such as this to 3%. The moratorium still remains up to 1 year, and during the application process, MSMEs have the option of ensuring that they select a moratorium that would work best for them at a time like this. The term of the loan remains between the range of 2 to 3 years. This was taken into consideration based on the information that we have received even from the Ministry of Information, which states that at this moment, COVID-19, we are all not sure when it would go away. But we are also given the option for MSMEs to be able to hold their businesses and support their employees at a time such as this. Currently, we have received some calls about the technology that we have launched. And I think it's important to share this on a podium such as this. Some of the challenges that have come up are that the USSD code times out at some point. It is important to note that the USSD is a short process, and so we have to be efficient in inputting data onto that. And also there were some technology or network challenges. And so we've worked to ensure that we have an efficient delivery of the USSD going forward. We also have set up a grievance center to ensure that all the complaints that we have would come to that portal to assist us answer the challenges that Ghanaians face. We have received some calls that the code hangs at some point and they are not able to finalize it. This is about 1% of the calls that we have received. And we want to assure Ghanaians and MSMEs, the micro, small, and medium enterprises, that we are working on this day and night to ensure that we give nothing but the best. We are happy to say that we received over 1,000 calls as of yesterday, people asking how they can access the platform and how best they can be supported, and to address some challenges that they might receive. The good news is that to date, we have about 5,000 plus applicants on the platform who have registered and are waiting to go on to the next stage. We are happy to say that we are started and ready. We have provided accessibility. The technology is working. We are working on any challenge that might come up. And if Ghanaians or micro, small, or medium enterprises have any challenges, they should not hesitate to reach out to us so that we can both work this out and ensure that we provide nothing but the best, an efficient system. And they support us to build an efficient system that will withstand the test of time, that can also be used in the future when anything else comes up. So I want to thank you all for your time and your commitment and your patience in working with us to ensure that we deliver nothing but the best to you. And we hope that you continue to reach out to us and you would apply and we'll be able to support you and your businesses grow. For this is a great time to be an MSME. And so we appreciate your support. Thank you very much.
Thank you very much, Executive Director at the NBSSI. Enterprises that have between 1 and 5 employees are defined as micro enterprises. Between 6 and 29 are small enterprises. And between 30 to 99 are medium-scale enterprises. We are told that the initial suggestion was for an interest rate of 5%, but His Excellency the President, upon consultation and in his wisdom, has reviewed that interest rate down. It is 3% now. The moratorium remains 1 year. The term of the loan ranges from 2 to 3 years, and we have been told that interest is very high, evidenced by the over 1,000 calls that they have received so far, and over 5,000 applications that have also been received. You recall that application opened on Wednesday, May 20, and will end on Saturday, June 20, 2020. And so the number of calls and the number of applications happened just over 1 day, and that's some very, very high interest. For those of us who are interested to apply, you can visit the following website: nbssi.gov.gh/CAP support, nbssi.gov.gh/CAP ghana.gov.gh/CAP support. If you are interested to use the USSD, please dial *718*555# or call the helpline 0302-747777. You can also email the NBSSI at capsupport@nbssi.gov.gh. We thank you very much, Executive Director Kozi Yankee Aye, for that update. Distinguished ladies and gentlemen, we shall now take our regular update on case count and case management, and the update shall be given by Dr. Patrick Kuma Abuaji, the Director General of the Ghana Health Service. Dr. Abuaji.
Thank you very much, Honorable Deputy Minister. Distinguished colleagues, the media, I'm going to give you a brief update of where we are, as we usually do. I will start by reminding all of us that our strategy remains the same, of containment and control of the virus through contact tracing, isolation, and effective management of all cases, both in isolation centers and our treatment centers. As at the last time we presented here, between the 18th and 19th of May, a total of 173 new cases has been recorded in Ghana. 46 of these cases have come from Greater Accra, 6 from Eastern Region. Central has recorded 27 new cases. Western Region also increased by 59 cases, and followed by Ashanti with 35 new cases. At the same period, we have also recorded an additional 144 recoveries since the last update. And so the total count for recoveries now stands at 1,898, bringing our recovery rate to about 30.2%. But I must let you know that we have a large pool of people waiting for their second test, and I believe that in the next few days, the new numbers will be added. This has come out of, let me get back. So our total cumulative count of cases from the first to the last now is 6,269 cases with 31 deaths. In the same period, up to now, we've done about 187,929 tests, 49,661 coming from the routine surveillance, and another 138,000 plus coming from the enhanced contact tracing. We have so far recorded 31 deaths, as you have seen on the website. Of this number, 8 of them are over 65 years and more. We have 3 who are under 20, mainly 9, 6, among other things. Greater Accra obviously accounts for the larger number of deaths, accounting for about 20 out of the 31 deaths have come from Greater Accra, especially when you look at the fact that about 80, close to 90% of our cases are in Greater Accra. 17 of them are males and the rest are females. And of the 31, 28 have some comorbidity, that is, they have some other illness that also contributed to the outcomes that we got. Further update on our case management. All our 16 regions have so far identified and set up at least one center at the regional level and about 2 outside the region, treatment centers and isolation centers. You know, we have a total of 71 treatment and isolation centers across the country. This is just to buttress the readiness the system has prepared. Currently, 50 are being functional. Some are not functional because there are regions who have so far not recorded a case, but they are ready with centers for treatment should a need arise, and isolation. This is beside the quarantine centers that we find periodically when there's a need to quarantine people. On our critical cases, so far we have managed about 31 cases in the ICUs as we speak since the beginning of the pandemic. We've had 6 deaths of people who have been sent to ICU, which means that the rest recovered. 16 have been discharged, and currently there are 8 of them in our ICUs. 4 in the University of Ghana Medical Center, 2 at Ghana East, and 2 at Kolebu Teaching Hospital. None of them is on ventilator as we speak now. Our largest isolation center, that is the Pentecost Convention Center, has a total number of 251 there now. This has been a massive reduction from the 450 or so that we've been recording over the last, since we started setting up the place. That's when it peaked at that level. Okay. Now let me give you a short breakdown of the new 73 cases and where they've come from, so I'll give you some further updates on that. Next slide. Yes. Of the 173, as I said earlier, 46 came from Greater Accra, Ashanti 35, Central 27, Western 59, Eastern is 6, and that is all. But if you look further, you can see that at the regional level, the cumulative total for the regions remain 21 for Upper West, 20 in Upper East, Northern region has 31, and the rest, as you can see up there, with Greater Accra having the lead with about 4,582 cases across the country. The next slide will show you where the districts are scattered. All the districts. This is very similar to what we have. But we are seeing that a place like Wesimintim that used to Takoradi Metro, Second Takoradi Metro, we used to report relatively low figures, have a surge with recording about 54 cases alone in Central. So you see that that place, the color code will change. Zooming back in Greater Accra, the places where you have white also show that they have recorded less than 50 cases, and most of them are quite a few. And the deeper red are where we are having a more significant number of cases in Greater Accra. If you can show the next slide. Yeah, so you can see Ablekuma Central, Accra Metro, among others, showing deep red, part of Tema East showing very huge colors. So these are where we have surges coming from. We have a similar figure for Ashanti region, where we have Kumasi Metro, Boase, Oforikrom, among others, showing the increased number of cases. But like I said, these are the cumulative number of cases. They may have recorded high numbers at that time, but currently, as you saw in the breakdown, in the last 1 week, these places are recording relatively fewer or virtually no cases since we started. So ladies and gentlemen, I will conclude by saying that we are seeing the new positives slowly declining that are recorded daily. we've seen a gradual decline. But also the number of cases on admission continues to come down significantly in our hospitals. The cases in our isolation centers are also slightly reducing, but we are seeing, and I believe that's going to be the nature of the situation we are in, occasional flare-ups in strategic areas, as we saw in Bibiani, Tema, Obuasi. But we have strengthened our system to be able to respond appropriately by massing our forces, as we've done in Tema and Obuasi and Bibiani, to be able to contain these outbreaks. And I think, like I said, that's going to be the next stage that we are going to look at in terms of identifying hotspots and quickly responding to contain them. We can see there's some containment in Bibiani. That flare up about 3 or 4 weeks ago. Tema is under control, and so is Obuasi. Thank you very much.
Thank you very much, Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaji, for that update. Ladies and gentlemen, the update indicates that about 11 regions out of the 16 from the last update up until now have not had any new reported cases. About 11. And so only Greater Accra, the Eastern region, Central, Western, and Ashanti regions have recorded new cases. That has moved Ghana's total number of reported cases marginally upwards by 173 new cases, putting our total case count today at 6,269. We have also seen from the last update up until now 144 new recoveries. And recall once again, ladies and gentlemen, that Ghana's protocol is 2 straight negative results to be declared fully recovered. We are aware that there are several persons in different cohorts who have already undergone their first test, and they are waiting for their confirmatory second test. Inshallah, they again shall test negative, and I'm sure that the numbers of recoveries will go up. That has moved Ghana's recovery numbers to 1,898, over 30% recovery rate that we have today. Let's also take note that we have been told that we have identified, the Ghana Health Service has identified 71 treatment and isolation centers, 50 of which are functional, because there are some regions that do not have cases that require the use of treatment and isolation centers. Whilst we say this, it is important that we continue to pay attention to the preventive etiquettes. The way to get more and more regions to not report new cases is to continue to observe the preventive etiquettes of social distancing. If you do not need to come out, you don't have to. If you have to come out, you should endeavor to respect the etiquette of social distancing, washing your hand under running water with soap. You have to wear your mask. It's important that you wear your mask, because when I wear my mask, I protect. When you wear your mask, you also protect. And the Minister of Information, a few moments ago, invited us to begin a conversation about living with the virus, the new normal. We don't have a vaccine yet. We do not have a cure. We cannot remain in our rooms and in our houses forever. We have to come out at a point, and we have to lead normal lives, as normal as possible. We have to get back and live with the virus, which means that we have to continue on the trajectory of no new cases. And I think that the people of Ghana who are paying heed to all the instructions and directions that are being given, which is leading to these scenarios that we are seeing of fewer and fewer regions reporting new cases. I think that people of Ghana must be commended. It takes an effort. Let's apply ourselves. Let's continue to do what we are doing, and especially as we are heading towards a gradual easing of the restrictions and then an introduction into the new normal. I think that it's important that we continue to observe the preventive etiquette. So we thank the Director General of the Ghana Health Service and his able staff who continue to sacrifice for Mother Ghana. We also are grateful to our frontline health professionals, doctors, nurses, community health nurses, all those who are involved in Ghana's fight against COVID-19. The country owes you a debt of gratitude. Ladies and gentlemen, one issue of concern to government is stigmatization. And today, we are joined by Dr. Gillian Bugi, a senior medical officer at the Bolgatanga Regional Hospital, Newborn Care Unit. That's a unit. So she's a pediatric resident. Doctor has a story to share, and it's important that we pay attention. Doctor, let me not preempt you. Please join us. Introduce yourself. Speak to us about what you do at the Bolgatanga Hospital. How did you get infected? Because she got infected. And then share your treatment and recovery experience with us because you have been treated and you have recovered. And tell us if you have suffered any stigmatization since your recovery. And what would your message to Ghanaians be on the importance of observing the preventive etiquettes? Dr. Gillian Bugi, please join me on stage.
Good morning once again. My name is Gillian Bugi. I'm a senior medical officer at the Bolgatanga Regional Hospital. Before I left for my residency program in pediatrics, I was the head of the neonatal intensive care unit. What we basically do at the newborn care unit is to help babies who are born and unable to breathe within the first minute of life, or babies who have breathing difficulties. We also do take care of pre-maturity, that's preterm babies, babies that are born less than the 37 completed weeks. We do take care of babies that have sepsis or infections, and then babies with congenital abnormalities. So I got in contact with the by then suspected case of COVID-19 on the 29th of March 2020. And on the 31st of March, I started showing signs and symptoms. I woke up on the 31st of March with severe bodily pains, fever, chills, and as the days went by, my symptoms increased with dry cough, headaches. And on the 3rd, the sample of the suspected patient's results came, and she had tested positive for COVID. So on the 5th of April, all persons who got in contact with the patient, samples were taken. And on the 6th, I realized I was unable to smell anything. I also had diarrhea. And on the 10th, I had difficulty in breathing as I started to desaturate with sore throat and unable to swallow. At this point, I started to write down messages in my diary to my family, taking pictures of my condition and making videos as well, because I thought one way or the other I had the virus. All this while, I was taking azithromycin, I was taking vitamin C at home, I practiced steam inhalation, lots of fluid intake. I took a lot of warm tea, and above all, I tried to pray. But our results comes in on the 10th, and my results was negative for COVID-19. But then, because of the fact that I was desaturating and I had difficulty swallowing, a decision was taken that I moved to the regional hospital, the female ward, and there I was admitted. And then on arrival, my saturation or my oxygen levels was between 75 to 85% room air. So immediately, oxygen was put on me, and then IV medications started. Even though my test results were negative, came in negative, I had all the signs of the COVID. So a decision, however, again was taken to retake my sample again. And then arrangements was also being made to airlift me to Kolebu for further management and in case of possible intubation. On the 11th, I was airlifted to Kolebu Teaching Hospital Medical ICU. Lots of laboratory investigations were carried out, and oxygen still continued at the ICU. IV fluids were set up on me, and also I was put on a cardiac monitor. After 5 days, my results for COVID comes in, and I test positive for COVID-19. When I was told the results, all what I could ask was if they could immediately take the sample of my sister, because she was with me all this while, even though we were observing social distancing at home. I still asked that they take her sample, and it was immediately done, and her sample comes out 4 days' time. She tested negative for COVID. I spent about 8 days in the medical ICU, and then when I was off oxygen, I was moved to fevers unit, where I spent 12 days together with the other patients who were also at the fevers unit. I had lots of psychological support from experts, senior colleagues, families, and mothers I had come into contact with as patients, both at the maternity ward and the newborn care unit. This played a vital role in my recovery. I was finally discharged on the 2nd of May, 2020. Back home, I was received by my sister and husband, and they have been very supportive. Have not yet experienced any form of stigmatization because I have mostly been indoors since I was discharged and have not yet returned to work. The COVID-19 disease is certainly scary, but despite the constant reporting on the total number of cases and climbing the toll, the reality is that most people or most patients that get down with COVID-19 do recover. Just as the number of cases increases, so is another number, the number of cases that survives. Catching COVID-19 does not mean you would have it for the rest of your life, or it's a death sentence. Let us all learn to share the facts about the disease to our families and friends. Let us support those that feel stigmatized and listen to them, help and then support them. Let us show support to healthcare workers and anyone involved in the care of COVID-19 patients. Let's thank them for their work, and let's share positive messages on social media. I will urge the general public to stop the stigmatization of persons who have suffered or who are suffering from COVID-19, for history will judge us by the way we treat them. It is important to practice social distancing, yes, but not social isolation. We must remember that it is the virus, not people with COVID-19 or affected by COVID, is the enemy. Let's not let stigma divide us and then turn us against one another. Let me use this platform to thank our Assistant General Secretary, Dr. Titus Bayo, who contributed immensely in getting me to the Kolebu Teaching Hospital. I will conclude by saying, let's all stay safe, let's stop the stigmatization and remember to practice social distancing and not social isolation. Thank you.
Thank you very much, Dr. Gillian Boogie. Social distancing and not social isolation. I think that that's food for thought, and we must recognize that, like has been said, the virus does not discriminate. The virus can be, if you may, democratic. Dr. Gillian used to provide care. She also received care. Anybody can get infected. We hope and pray against it. We work against it by observing the preventive etiquettes. But anybody who is infected, like we have been told, the person is not the enemy, it is the virus that is the enemy. And so we should continue to show love and care to even our compatriots who have tested positive. And we must be encouraged by the good news that the vast majority of Ghanaians who have been infected by the virus are doing well. They are recovering, like Dr. Gillian. We expect that very soon Doctor will go back to Bolga to resume her work at the newborn care unit as a pediatric resident at the hospital. So there is no need to maybe even ask about street proof of doctor's recovery. The fact that she was here and shared her stories with us is proof enough that she indeed has recovered. So we are grateful to you, Doctor. You are a true heroine of the struggle. Your country recognizes you, and we shall continue to pray for the speedy recovery of all of our compatriots. Our thoughts and minds are also with the families of our 31 compatriots who unfortunately have succumbed. But let us also use the opportunity to clarify that the way we capture our data, whether you die with COVID-19 or you die of COVID-19, the data captures you. And that's why we keep hearing of comorbidities, people with other underlying health conditions. And so strictly speaking, if we may even want to further interrogate that data and break it down to people who died with COVID-19 or people who died of COVID-19, the persons who died of COVID-19 are even lower. But we have captured all of those in the 31. I say this to encourage all of us that there is no reason at all, there's no basis for anyone to want to look down on anybody who has ever tested positive for COVID-19. We can come back to normal on our own immune system with the help of the medical practitioners. And so please, let's continue to show compassion, love, and care to our fellow Ghanaians who, and even non-Ghanaians who may have tested positive for COVID-19. Thank you very much, distinguished ladies and gentlemen. May I now open the floor for questions. If there are any questions, please, let's step forward and let's do this quickly so that our busy health professionals can get back to the business of caring for the sick, contact tracing, testing, and so on and so forth. And let us please also observe the social distance. We can take it two at a time. Your name and your quick question.
Okay, my name is Bridget Ayakomati, Metro TV. For the NBSSI, did you say companies with above 99 employees are not qualified for the loan or below? I need that clarification. And do you have any special attention for for businesses owned by PWDs? And what are the sanctions for defaulters?
My name is Sarah Parker, representing Media General. I have just two questions.
If you may, so we can, AD, companies with employee staff of beyond 99, are you saying that they are not qualified? Number two, do we have any special arrangements for persons with disabilities? And are there any sanctions for people who will default on the loans? Yes, sir. Next question.
So my first question also goes to her. I want to find out which category does the schools fall under, the private schools? Because yesterday it was still hammered by the Deputy Education Minister that they qualify to apply for this stimulus package, and they are asking for preferential treatment. We want to find out, do they fall under any of these categories so that we don't come back and hear issues like them being discriminated against. Let's know the category they fall under, who qualifies and who doesn't qualify. And secondly, to the Ghana Health Service, we know there is a committee that approves publicity on COVID-19 safety protocols. The EC has come out with 6 safety protocols ahead of the voter registration exercise. Is the committee aware? Has it approved those protocols? Thank you.
You want to share those protocols with us?
Yes, they talked about having 1 gap meters between people who line up, having hand washing bowls around, sanitizers will be distributed to people who would go through the process and leave. No face mask, no coming to the registration center. So basically, those are the things they are looking at going through.
Thank you.
My name is Joseph Akabila. I work with JoyNews. My first question, health experts have made a point that if we have a lot of infections, our health system may be overwhelmed. The Director General made reference to the fact that there are some sort of centers across all 16 regions. I want to find out in specific terms, what is our capacity in terms of our ability to have people in various centers and provide treatment for them across the country.
You mean numbers?
Numbers, the total capacity that we can hold.
Bed numbers.
Yes. And the other
And that was our live feed, our live coverage of the Minister's press briefing, the second in the week on Ghana's coronavirus situation. We received updates from the NBSSI on stimulus packages being given to businesses who are affected by the pandemic. We've also received updates from the Ghana Health Service on our case count. Just a while ago, the minister was taking questions. But even before then, the information minister spoke about living with the virus. And that is something that the Ghana Health Service, together with the other stakeholders, will be giving us more details subsequently on how we can live with this. But on the case count, we know that we've recorded 173 new cases. This is as of May 19th. And the recoveries have also gone up. We have 144 new recoveries, bringing the total number of persons who have recovered to 1,898. As we speak, there are 8 people who are in critical condition at the ICU. 4 at the University of Ghana Medical Center. But these people who are at the ICU are not on ventilators. They are not yet at that point. We'll head back to the Information Ministry and get those questions, as well as the responses to the questions being asked by my colleague journalists who are there. So that is the latest from that. On the stimulus packages, what we know is that 5,000 applicants, have registered. 5,000 applications so far. They are waiting for the next stage after they have been cleared. And we know that modalities have also been spelled out. Companies that have total staff strength of over 99 are not qualified. There's some clarity on that has been sought. Hopefully, Dr. Kosi Aya will bring that to us as well. But here is it from 1 to 5. We also have from 6 to 29 and then 30 to 99. These are the categories of businesses that will be looked at. And the interest rate initially was just 5%, but upon appeal and consideration by His Excellency the President, we are made to understand that it has been reviewed downwards, and now the interest rate for the packages that will be given to the businesses remain at 3%. Of course, they will have a one-year moratorium, 1 year, enough space to start repayment. That means that you're going to pay after a year. And so that is the latest from that press briefing from the Information Ministry. We'll head back there once we have the feed. But also coming up here on News Desk, the CDD Ghana has written to Parliament's Education Committee advocating the guardian of autonomy of the public universities. We'll hear from the chairman of the Education Committee, who will tell us how many messages or letters they have received so far on this university's bill, as well as hear from CDD on their position on this. Boko Central MP to move motion on behalf of the minority in Parliament to seek that the House rejects the constitutional instrument that gives the Electoral Commission the green light to compile a new voters register with a new set of rules. We'll bring you details on that. Also here on News Night later, dozens of homes in the Ashanti region demolished to make way for the construction of a road project in the Ifija Kwabre district. We'll be live in the region. And later, in business, interest payments for COVID-19 stimulus packages for SMEs now reviewed downwards to 3%. We head back to the Information Ministry for some more responses.
And provide maximum support. It's open and accessible for all, but this is it. As of yesterday, the numbers that I had registered, 33% were women and 66% plus were men. And we hope that the women will be encouraged as well to apply for this facility. Are there sanctions for defaulters? Yes. In designing this program, we work very closely with the participating financial institutions. The application process will go through the participating financial institutions, and the funds will be disbursed by them. This allows for transparency, allows them to see who they are lending to, because the banks own the lending process, will be able to monitor. And if you default, it's a credit, it's a risk. And so they would ensure that the next time if you need challenges or you have problems, you are not recommended. So all of that are some of the sanctions. The other sanction is that next time when there's an intervention, we will not pay close attention to you. But it's also important to note that in everything you do, you need to look at the risk and how to mitigate the risk. So what we have done with this program, besides the financial support, we have technical assistance and support. The technical assistance and support will ensure that we are monitoring and following up. We're giving you training to also turn around your business if there's a challenge. For those, especially in the micro sector, who do not have very good bookkeeping skills or systems, we look to digitize and support them with it. Because the world has changed. A lot of things we will do going forward will be based on digitization due to the challenges that the COVID-19 pandemic brought. So it has also brought some good and changes to the sector for the micro, small, and medium enterprises. You asked about the private education. Yes, as I mentioned, education, private schools can access these loans if they fall within the targets that we have set. So they are eligible. Now, you mentioned if they do not fall and if they feel discriminated against. It is accessible to everybody. It is not to discriminate against an individual or to discriminate against a sector. So if you feel the need, if you think you need the funds and the support, go ahead and apply. And will allow the system to work to ensure that you get what you need. Thank you very much.
Thank you very much. And it's also important to note that at the launch of the support scheme, His Excellency the President directed that the highest levels of transparency and openness be observed during the entire process. And so we look forward to that. And it is in the spirit of transparency that the Executive Director is even here on the podium to walk us through who qualifies. Ladies and gentlemen, you know that because of social distancing, some of our colleagues are watching from home and the various offices and are asking questions through our WhatsApp platform. I shall invite Mr. Kweku Obing Eje to give us questions from the platform. Kweku.
Thank you very much, Honorable Deputy Minister. So just a follow-up question to the bit on the NBSSI. Are there other factors for determining who qualifies to apply for the stimulus package? Is the number of employees the only criterion? What about turnover, for instance? Because it's possible to have a company with over 100 employees that generate a turnover that's lower than a company with, let's say, 25 employees. So that's a question to the NBSSI boss.
So before the NBSSI boss comes to respond to that, there are some questions that stand in the name of the Director General of the Ghana Health Service. Doctor, please respond to those questions that stand in your name. Then we can take, please take this podium.
Thank you very much for the questions. I'll start with the testing capacity. We have currently 9 testing sites. And this is the Pond Tamale, the Tamale Reference Laboratory. We have the KCCI in Kumasi. We have Komfanochi Teaching Hospital also testing. We have the whole UHAS testing. We have in Accra, CSR, Noguchi, the Veterinary Service Division Accra, as well as the reference lab of Kolebu. That brings the total number to 9. The least number that any center can do under normal circumstances is about 400. Noguchi has more than 2,000 capacity, but depending on whether you want to run a 24-hour service or you want to do sampling, this capacity can significantly expand to contain that. So it depends on your need. You may decide to do 24-hour service. You may also decide to do other method that allows you to do more tests at a time. So I'll not be able to give you the exact number, but depending on the circumstances, we can expand to catch the way needs that's done. On the issue of our bed capacity, we started with about 37 centers. That gave us about 451 beds. This number changes because there are centers that are kept opening daily. Understand, focus is also have a space now. We are creating a 14-bed one in Obuasi this week. So currently we have no less than 700. But if you look at the further, we have roughly about 195 in admissions as well. Like I updated yesterday, that gives us an excess capacity to respond. And we have the capacity to move one patient from another. 37 has about 2 centers where they are using. We still have the Bank of Ghana site, which we are yet to use because we don't have the spillover to move in there. So that gives us enough reserve capacity should there be the need. But like I told you, the numbers of even those who care are gradually coming down. So we should be okay. The number of first tests, it's a very moving figure. I really cannot stand here and say, this is the number. Someone has just had their first test today. But what I can tell you is that after my briefing yesterday, Ashanti region brought 42 recoveries, and they had done 140 first negatives waiting. I can also tell you that more than 600 people in the Tema have had their first test and they're waiting for their second test. And I'm sure the results will come in probably from today or tomorrow. Now, when you are admitted, the first negative test averages about 2 weeks from the admission. But if you know the history or when the condition started, you could be tested earlier. And so, especially for those who may have been exposed earlier and the results comes late, you are able to test them immediately to see whether they are still negative or they are positive. So that's what it is. The second one is usually within 48 hours, you retest. The essence is to be doubly sure that because a new virus, we are not too sure how it behaves, so that we have double assurance that you are still negative. That's why we do a third test. Not every country does that, but we have chosen to do that to be sure that people don't go back and show negative. So I think those are the questions that I have, unless I've missed anyone. I really wouldn't want to say EC or church or whatever. The protocols are basic. Social distancing. In any way, that has to be done. Depending on your environment, you need to adopt the appropriate measures of mask, hand washing, and appropriate distancing. So it doesn't really matter whether in this setting, whether it's in a factory or anything. The principles are the same. And as long as you abide by it, that should be okay. Thank you very much.
Thank you very much, Director General. Executive Director at the NBSSI, there was a question about are there any other criteria, for instance, turnover and so on, that stand in your name. Are there any questions? We can take them now. My brother from CT, let's take your question and then we can have the last cohort of answers. Any other questions? Yes, sir.
Good morning. My name is Kojadman from CT News. Doc, we want to find out, you said that out of the 31 deaths, 3 had no pre-existing conditions. We want to know what really took their lives. And then we also understand that the 50% allowances for frontline workers have not been paid. When are we seeing this money hit their accounts? We also get a report that the contact tracing teams across the country have also not been paid their allowances. When are they getting their allowances? Thank you.
Thank you. Executive Director, you will respond to your questions before the allowances questions. Doctor will address them.
Besides the number of employees, turnover is also part of the definition. But for the purposes of trying to retain employees for the MSMEs that we are supporting, hence using that. The question asked also if someone has 100 employees and is making less money. I have 2 responses to that. One, you have to be very clear on if they are temporary employees or permanent employees. And what we are talking about here are permanent employees. Because if you're saying that you're making a lower turnover, then the second question would be, are you paying the minimum wage if you have 100 plus and you're making what a micro business is making? Then automatically when you put it in the system, it doesn't add up. Because it should be able to say if you have 100 employees and you're paying them above minimum wage or what they should be paid, then you should not have to worry about this. So maybe you have temporary and permanent, and all of that will be considered in the decisions that we make. Thank you.
Thank you very much. Director General, if you would respond to Mr. Jiman's questions. Mr. Jiman, CTFM, he has some questions, please.
Thank you, Mr. Ajuma. It's a regular feature of these questions. Great. The contact tracing teams. As far as our records are concerned, all contact tracers have been paid. What I've also heard that they have laid off their tools, etc., among other things. You see, the number of contact tracers you take depends on the number of contacts you're following. During the lockdown period, we recruited about 1,000 or so volunteers to join our health workers. As the number of cases come down, you reduce the number of contact tracers that you need. So if you have 20 teams in Tema or Ashama for a period, and now you are going to look at 5 contacts, you don't send the same 20 teams around. And so the numbers come down. And now we are relying more on our workers. And when we have a surge that we had in Tema, we bring our volunteers to join the team to look at us. So that's what I would say as far as concerned. The 50%, I believe the ministry is working things out, and they will be paid as and when those assessments have been done to see who benefits, and they'll be paid. I don't think it's a question of not being to pay, but how to do the processing that will be done. The 3 cases. Currently, since you don't know any underlying other cause, the only cause we can assign to is the highest cause of death is COVID. But of course, we haven't done autopsy. There may be some underlying that we have not discovered, but we assume then that is COVID that caused the death. But the others also had comorbidity, who may have been exacerbated by the COVID infection to lead to their death. So I think those are questions I will answer. So thank you very much.
There's a follow-up question. Let me quickly chip that in. So there's a request that if you can please differentiate those who had the comorbidities and those who didn't. If you can explain why it matters. And then also, do they do autopsies on those cases?
Okay, no, thank you. You see, when you have any underlying condition, it means that your ability to fight certain diseases is reduced, and especially conditions that reduces your immunity. One of the things diabetes, for example, does is to affect your immunity. Hypertension, any heart condition, affects your breathing. And COVID is primarily a respiratory disease, and so it exacerbates your condition. It may lead. That's why we had a lot of the majority of the comorbidity has been hypertension and diabetes, and these are some of the reasons that one can advance to that. What was the other question? Autopsy, yes. Autopsy, as was described by Dr. Bedusakwe last week, is necessary, but has to be done with caution, and the pathologists do it under special circumstances that prevent them from getting infected. And that's why we so far had about 2 autopsies. So if there's a reason to do autopsy, it is done, but it's done in a way that protects the pathologists and other people who will participate in that. And in the same way that we do our supervised burial, to do it in a way that does not endanger the people who are doing the work. So thank you very much.
Thank you very much, distinguished ladies and gentlemen. Let us remind our viewers and listeners that translations of the press briefings into 13 local languages are available on the social media handles of the Ministry of Information. We encourage our media partners